I hope that there's some form of baseball this summer, even if it's just TV. And I do that I feel that strongly, one, because I'm an avid baseball fan, but also, it's for the country's mental health.
I'm Julie Pace, Washington Bureau Chief for the Associated Press, and this is Ground Game. The coronavirus pandemic ranks among one of the most consequential stories ever covered by the Associated Press in its 170-year history. Here to take you inside the outbreak is AP's Ralph Russo.
From the Associated Press, this is Inside the Outbreak. I'm Ralph Russo. Today is Thursday, May 7th. The Associated Press reported exclusively this morning that a detailed report from the Centers for Disease Control that gives step-by-step advice to local authorities on how and when to reopen public places and businesses has been shelved by the Trump administration. This comes as many states allow once closed businesses to start welcoming customers again. Elsewhere, pro sports leagues in the U.S. are showing flickering signs of coming back to life after seasons that have been put on hold or not started at all. Still, there are no concrete plans to resume play in the NBA and NHL or start play in Major League Baseball. Today on Inside the Outbreak, we'll consider what it will take to have college sports when school starts in the fall. College football is a multi-billion-dollar business and a Saturday ritual for many across the country. We'll speak with Dr. Brian Heinlein, the NCAA's chief medical officer, about how colleges will go about determining whether it is safe for students to play and fans to attend the games. Dr. Brian Heinlein is the NCAA's chief medical officer. Dr. Hainlein, thanks so much for joining me today to provide a little insight on when, how, and why we might be getting sports back in the fall.
Well, thanks, Ralph, and it's always a pleasure to be speaking with you.
Yeah, we have spoken a lot lately, and as I said to Dr. Hainlein before we started recording, as much as I enjoy our conversations, I'm hoping for a time when we get to speak a little less. So let me get into some of the latest news. The NCAA's COVID-19 advisory panel recently released guidelines for schools to follow to get their teams up and running. It's a 3-phase plan that in many ways mirrors a White House plan for reopening businesses. What are the most important factors that will determine whether college teams can start gathering, practicing, and competing?
Well, I think a couple of factors are really important. One is that at the school level, that there's really good surveillance in place. So the ability to track new cases and to understand where they're coming from, to isolate, that's going to be important whether you're in a business or at a school. And of course, student athletes are first and foremost students. And it leads to another very, very important part of all this, and that's testing. The two types of tests, the serological test and the point of care test, ideally they would be in a better place than they are right now. So serological tests, we know that they still are not in a place of being validated, and that's really to assess whether someone has evidence of past infection and whether that evidence really means that there is immunity present for that person. And the other very important test is point of care. So a rapid diagnostic test that allows one to determine if someone who's symptomatic or before you're doing certain kinds of activities like a game, that you can test to see if people in fact are currently infected, and that really then leads to decision making. So you really need to have those two things, I think, pretty solidly in place if we're going to be able to re-socialize sport.
So how can colleges and universities go about acquiring tests when they still seem relatively scarce?
Yes, that's I think the key question. So a little more than a week ago, there was a call with the White House. It was Dr. Birx's office, and it was with the chief medical officers of sport. And those are the questions that we really asked. And so the White House says, well, the infrastructure is going to continue to improve, and we're going to have more diagnostic tests. And that was said on the one hand, but on the other hand, they also said, well, it might be really important for conferences and schools to start looking for arrangements either with research laboratories or hospital laboratories or even private laboratories. So it's not a well-formulated national plan, and it really makes it state by state and even district by district and conference by conference. And so that's a very important issue and a detail that needs to be ironed out much better.
So with professional leagues, there has already been talk about sort of the ethics of let's say the NBA testing players who are not symptomatic. We take that framework and then move it to college. College has a different dynamic. Can athletes be tested without the rest of the student body having access to that testing?
No, I don't think that is an ethical framework that's workable. The athletes are first and foremost students, and they need to be treated like students. And so the entire student body needs to be in a place of safety. And within that includes athletes. So what you don't want to have is a scenario where you're treating the athletes in a different way and treating them almost as if they would be employees or semi-professionals. That's not the model of the NCAA. So it has to be really equitable across the campus.
And with that said, one of the things we've been hearing from college sports leaders at all levels is we have to have somewhat normal school before we have college sports. Again, I think that's another thing that people may forget because college sports are such a big part of our lives and they are such big business, but they are just part of college. We've heard that a lot. Is the NCAA dedicated to having that be the case? The fact that we cannot have sports until we have college back to somewhat normal on campus?
Yes, that's really the working assumption. It's the motto. I think it was best summed up by Bob Bowlesby, the commissioner of the Big 12. The FBS commissioners all met with Vice President Pence virtually, and he said, we have to first and foremost have college students before we start thinking about fall football at the collegiate level. So it's a really important consideration, Ralph, and it makes things logistically a bit tougher for collegiate sports than professional sports, where you have agreements, for example, between the NFL and the NFLPA or the NBA and the NBA Players Association, and they can make decisions about where they're going to be and if they're going to really restrict their access. But that's much different at the collegiate level. So that's the beauty of collegiate sports, but in a pandemic, that's what makes it a little more challenging.
So will the COVID-19 advisory panel provide guidelines to schools on what to do when teams do return to competition, one of their athletes gets sick? I know that's a concern among administrators, athletic directors, commissioners. Has there been any thought to providing some guidance to schools on what they should do if that happens?
Yes, considerable thought. So just to give you a timeline, so we released our core principles document just this past Friday. Yesterday, we released a frequently asked questions document, which doesn't go into the granular detail, Ralph, that you're talking about, but it was the first step. And so importantly, a few things are happening in the background. One is that we have a committee, it's an association-wide committee at the NCAA called the Committee on Competitive Safeguards and Medical Aspects of Sports. And they're looking at all of the what-if scenarios of return to sport. And we're working in conjunction with another group, the American Medical Society for Sports Medicine. So there's a core group from their leadership who is devoted to answering or addressing all of those questions in all three divisions. And also our colleagues at the National Athletic Trainers Association and the Collegiate Athletic Trainers Society. So we're working out the level of details for what happens in the locker room and so forth. And then there's another internal group at the NCAA, we're calling it the COVID-19 Playing and Practice Seasons Working Group. And that's also a group that's developing all of the sort of what-if scenarios. And so what we are planning on doing over the next couple of weeks, and it really is a phased-in approach, is how do you first set up a general environment that is going to allow for phase 1, phase 2, phase 3? What are the necessary requirements for that? But the real challenging part, and I think it's the most important part, is what is the scenario that you have when someone is going to become symptomatic and develops COVID-19? So it plays out a little differently on a cross-country team than on a football team because of the high degree of contact. So in phase 1 and phase 2, for football, it might be a little easier to manage. But once you're really engaging in contact, it's almost unimaginable to carry this out if we don't have a plan in place that has point of care testing. Because otherwise, what you're really left with is putting everyone in quarantine for 7 to 14 days who's had close contact, and that essentially would be the entire team. So as the chief medical officers of sport are going through this and thinking about it, the answer ultimately at that granular level has to include a game plan for testing.
So I just want to clarify something there because we, again, Dr. Hainlein and I have talked a bunch recently, and we had talked about this idea of being able to coexist or cohabitate with this virus. I hate to make you speculate, but I'll try to go there. Could you see a scenario where a team member becomes sick, tests positive, but the team does not have to shut down? And again, I'm thinking more along the lines of a football team, again, when there really is a lot of close contact. Is that conceivable that a member of a football team could become sick or could test positive and that the team could continue competing?
So that's the key question. And the only conceivable answer so far that all of us are coming up with is that we would have to really be monitoring people on a daily basis with diagnostic testing or close to that. I'll be honest, in terms of the key details for that, we're still speaking amongst one another and trying to come up with the best answer, because if you think about it, where we are right now, I mean, we're in a place of, it would be contact tracing and then isolation and being certain that there's no further spread. So if you can do once daily testing, twice daily testing, and it's not just at a football team, it's also what are we doing when someone on the campus becomes symptomatic and becomes sick? Does the entire campus have to shut down? So those really are the key questions. And I would say as of today, I don't have that answer. I'm not sure anyone does. But that's what's going to be really the determining factor if we're able to move forward.
Let me also ask you this, because I've heard this thrown out there. You've really stressed the testing and surveillance part, and that certainly makes a lot of sense. We've heard that from many other sources. The idea of getting back to somewhat normal as far as sports are concerned, but not having a vaccine. I've heard at least some people suggest, how can you do this without a vaccine in place? But it sounds like you were pretty confident that we don't need a vaccine to go about and sort of bring sports back.
Well, I think it really is, how can we partially bring society back? And sport is the great metaphor for one aspect of society, which is important culturally. So, the real question is, can a vaccine even be developed for COVID-19? There's an assumption that it can be, but we weren't successful in developing a vaccine for SARS or for MERS or for AIDS, HIV. So, that's a leap of faith in some ways that we can do that. I'm certainly hopeful and would love to see that happen, but that's one aspect of things which is certainly not a guarantee. And the other is can there be a treatment that would neutralize the manifestations of COVID-19? And I think, we don't have a good answer on that. The one drug that's FDA approved, it's certainly not a blockbuster. So that's another consideration. The other is that this virus simply mutates to a less virulent form, but that's also another sign of hope. And otherwise, it's how do you as a society co-habituate with this virus in any aspect? And sports is one part of that. So that's the real struggle, Ralph, that we're all trying to come to terms with. And the answer is not that we say, well, let's just take a risk and younger kids are less likely to get sick than adults, and so let's take the risk and let them get infected. So that is not the answer, although some of the younger people in our society are saying, well, why not have that be the answer? So just to be clear, although that's been expressed, that's not an opinion that the NCAA holds, and I don't think any professional sports organization has held that.
Let me direct this to another aspect of college football, and that is tens of thousands of people are drawn to stadiums for these games, hundreds of thousands in some cases, but hundreds of thousands of people will descend on small college towns. They end up bursting on many fall Saturdays. Do you think there is a way to have fans tailgating, attending these games as usual this season, whenever this season occurs?
At least as I try to imagine it now, and the rollout, phase 1, 2, and 3, and even getting to the point that we can play games, having fans at attendance is not even part of the framework. I think we first have to get it figured out. Can we actually have athletes competing in contact collision sports? It's much easier, again, imagining doing that in cross country, but football is different. So that's the first step. And then if we were to have fans, let's say that we can get to that place, it certainly is not a scenario where we're going to have 100,000 fans in a stadium. So you would have to make certain that you're doing something that's responsible not only for the fans in attendance, but for the town. And so that you're not all of a sudden going to make that a hotspot. So I don't think anyone has really crossed that line yet in terms of having a well thought out game plan, because the focus really is just to see if sports can come back.
Okay, so I'll ask you to be a bit speculative here, but then also fall back on your expertise, which is more fact-based in science. So I'll ask you, do you think we'll have a college football season this fall? That's more of the speculative part. The other part is, what is the path to doing that?
So I'm cautiously optimistic we could have a football season this fall. I think the path to doing that is really going to be some creative solutions with not only members of the advisory panel, but the other chief medical officers of sport. And even, you take conferences, and I'll name one as an example, the Pac-12 conference, where they've demonstrated great leadership with their medical advisory board and coming up with a lot of creative solutions. And they've already been ironing out a lot of the details that would be necessary. So I think when you put all of these creative and good minds together, that you can lay out the scenarios where that indeed can become possible. Those are a lot of ifs and suppositions, but so far, at least amongst all of those groups, no one has thrown up their arms and said, look, this is just not even conceivable. So we're all still moving ahead. And it seems like every week we're getting a little closer to identifying solutions that may work. But again, no one has gone there without first and foremost saying we really are going to have great surveillance and great testing in place.
Okay, one last broad question for you, Dr. Hainlein, and you also consult with the United States Tennis Association, which runs the U.S. Open. You have been involved with the U.S. OC, the Olympic Committee. Sports are a big part of your life, and they are a big deal to you. The White House has taken a keen interest on getting sports up and running, as you had mentioned. As much as many people love sports, these are not essential businesses in many ways. Why do you think it is seen as important to have sports up and running again?
I think from the point of view of who we are as human beings, and this is a humanity issue, sports and culture, we can say that's not essential from a basic economic point of view. I mean, we have to have certain businesses up and running. But from another point of view of what does it really mean, in humanity? I mean, even the evolution of Homo sapiens. I mean, sports isn't an accident. It's really a recreation of so much of who we are. And I think that's what draws people to sport, both to watch sport and to participate in sport. It takes you to a whole other level, not just physically, but mentally, emotionally, even spiritually. And from another point of view, when sport is reemerging after something that has really devastated society, it's something that is a very physical manifestation of hope. And so I think if we redefine what essential is in terms of what really it means to be a human being and to have that sense of hope, there I see sports as being important. But again, always putting it in the context that we have to do it safely.
Dr. Brian Heinlein is the NCAA's Chief Medical Officer. Dr. Hainlein, thank you so much for joining me today. Please stay healthy, please stay safe, and maybe we'll be speaking again soon.
Well, thank you, Ralph, and you stay healthy and safe too, and thanks once again for this opportunity.
At apnews.com, today's One Good Thing feature is a story about a fearless survivor. 80-year-old Galina Yakovleva was a child during the World War II siege of Leningrad in Russia. She learned to make the best of dangerous times. Today, she's using those lessons as she brings food and supplies to needy people locked down in the coronavirus pandemic. Galina drives a white minivan through what is now known as St. Petersburg on a one-woman charitable mission for the elderly and needy families with children. She's been doing this for decades and hasn't let the coronavirus deter her. You can read that story and all of AP's coronavirus outbreak coverage at apnews.com.
That's it for this episode of Ground Game. We'll be here every step of the way during this extraordinary moment in American politics and American life, giving you all the news you need to know. Be sure to tell a friend about us, and please subscribe on Apple Podcasts and leave us a review. Some of the details of our discussion may have changed by the time you hear this. For up-to-date developments on all of your news, head over to apnews.com. From the Westwood One Podcast Network.